Okay, hi everybody. This is a presentation on magnet hospitals by Maria Amosa and Melanie Benton. So we'll get started. So magnet hospitals, I'll start with the history on here. In 1983, the American Academy of Nursing did a study. They were trying to identify the working conditions that were best able to retain nurses and giving the best care to their patients. And in this study, 41 of the 163 met these standards that they determined, and that from this study they came up with the classification of a magnet hospital, meaning one that provided superior patient care and had just a good overall experience for the nurses. So that's a magnet hospital, and our problem that we're presenting in our policy assessment is that all hospitals should be non-magnet hospitals. So all hospitals should attain that status, and the problem with non-magnet hospitals is just they consistently have worse patient outcomes than magnet hospitals. So all hospitals should work toward that for the better outcome of their patients. So the reason a magnet hospital specifically is the answer. Some details: magnet hospitals have higher nurse retention, so less job turnover. That means less time of having brand new nurses constantly cycling through, less resources of having to retrain people, less people who are not familiar with their job. So nurse retention is super important, and actual just job satisfaction reported by the nurses who work in these magnet hospitals is higher. And then the nurse to patient ratio is higher, so there are more nurses per patients in magnet hospitals than in non-magnet hospitals. So you're able to take better care of your patients because there's more nurses per patient. And then also in magnet hospitals, nurses have higher education levels. That's usually part of the qualification, is that registered nurses have bachelor's degrees, and then people in management positions have even higher degrees. So higher education overall of the nursing staff in a magnet hospital. And a lot of magnet hospitals finally also have really good teaching environment. They're focusing on educating new nurses. So stakeholders for magnet hospitals, nurses and patients are two really good ways to break it up of groups. We've kind of talked about the nurses' benefits, but nurses do suffer when they're in a hospital that doesn't meet these standards. With the same reasons we were talking about, the high nurse turnover means there's less consistency in the workplace, less experienced nurses, just like a more volatile environment, and they're just not as satisfied with their jobs every day going in, which leads to more nurse burnout, which is already a big problem in our profession, but it's worse when you're in a non-magnet hospital. And then patients are just as big a stakeholder, if not more, because in hospitals that aren't magnet, they don't have that status. There are actually increased fall rates for patients. They have overall longer hospital stays. And the biggest one is there's an increase in mortality rates in non-hospital or non-magnet hospitals. So huge difference for the safety and the outcome of the patients overall. So then just some possible solutions. There are a few different ways to kind of work toward this, toward incentivizing and making more hospitals want to achieve that status. We think a big way would be to involve state governments so that they were involved in trying to incentivize hospitals to get this status. And then there could be more specific. A lot of hospitals are already working toward this in our area specifically, but they can have contracts like upon hiring a nurse, a hospital could require a contract that they'll either have their BSN at hire or within 2 years of starting. Then they could add other incentives like the reason to meet those qualifications and work in a magnet hospital. You're going to get an annual bonus because this hospital is doing better and you're staying here, and that could lead to better nurse retention. So just a couple just general goals that are things that could maybe help work toward that. And then our broader goals of policy change. So what we came up with is we could have states an initial goal, because it's not realistic to just want everyone to immediately be a magnet hospital, but we could have each state being managed by their state government work toward having 50% of their hospitals attain magnet status by the year 2030. So once we have that timeline, then they can start working toward at least half of their hospitals, and from then on, hopefully increasing more and more, but that would be a good starting point. And then another goal another part of this is just putting it on the state government. It'll encourage an allocation of the resources toward improving these hospitals. So if they have this goal, this requirement to have 50% of their hospitals be magnet status, then they'll be more willing and more eager to give resources, give finances toward educating their nurses, better medical supplies, just an overall higher quality of the hospital. And then once this goal is met, like I said before, we could work toward an even higher percent than 50% in further years down the road. So the way this will affect our current healthcare system, hopefully in a lot of really positive ways. We've kind of been talking about some of these things already, but patient care quality would be expected to improve. Mortality rates would be better, and then frequency of failure to rescue situations, so patients that could have been rescued and were not, that will decrease with more magnet status hospitals. This change could also have political implications. It could definitely affect how nursing programs and licensure, how certain programs are accredited and everything. If the government started being involved, that could be affected, but we think it would be positive. Another effect that could maybe happen is, the overall financial effect would be positive because less nurse turnover saves money, less rehiring and retraining nurses, and better patient outcomes lead to less lawsuits and just overall less long-term patient care if problems are avoided, things like CODIs and things that would lead to more hospitalization. So a large change like this, talking about how it would affect the system, it would initially probably likely meet like a lot of resistance in leaders, especially people who don't understand healthcare and the outcomes. However, that's why it would have to be a policy that states are required to meet this at 50% goal, and then the states continue to give incentives to hospitals from there. And a policy like this is the most ethical choice because it protects the patients in the long run, and that's what we're all here for. The whole point of healthcare is to take care of our patients. So working toward hospitals that have better patient care is the most ethical decision we could make. So our final recommendation to conclude it is to pass a policy that would cause state governments to require 50% of all their hospitals to get magnet status by 2030. It could be implemented by giving aid to the hospitals so they're able to finance their nurse education. Like I said before, some Utah hospitals are already working toward that, like maybe giving 50% off of tuition to their nurses or even tuition reimbursement. So giving funds so hospitals are able to do that, maybe giving grants and scholarships to nurses who are pursuing higher education. And the states could control this by only giving that funding if the hospitals are compliant with all of the magnet status requirements of superior healthcare. So this could realistically work if detailed regulations and committees were put in place. So there will have to be, obviously, a lot of breakdowns, sub-policies, committees. People are going to have to carry that out to regulate that, make sure the hospitals are meeting magnet status, and who is evaluating that, and what is the timeline on nurses getting education. So there's going to be a lot more detail that has to go into it. But as long as there's enough incentive and enough requirement for this to be met, it's possible for it to be achieved. So kind of going into what I was already saying, that the way to evaluate if this is successful is pretty straightforward when you have a numerical goal like that. So really directly, it could be evaluated by the percentage, just seeing by 2030, are we getting close to 50%? Are most states 50% or above? Are people really not even close to that? And then even more important than that would be actually just talking to people who work in the hospitals, seeing patient outcomes. Are we actually having better mortality rates and less falls and less hospital stays? And then nurses need to be talked to evaluate this, absolutely, to see, is their job quality better? Is the situation they're working in better if their hospital does become a magnet status? So those are the best ways to evaluate the success of this policy. And then these are our references.